Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I am going to be going live on TikTok. I'm going to be doing a Kahoot where I go over antipsychotic medications. Now, I did this video last night, but I actually decided to do another Kahoot because from the feedback that I got in the comments, it really wasn't that clear. So I want to make sure that you guys can see all the answer choices. So I'm doing it again. You can watch this video or the other. The information is still the same. As always, I'm going to ask you to please support me and support this channel. Please like this video, give it that thumbs up, subscribe to my channel if you haven't done so already. And don't forget, now you can book for an NCLEX NGN review. This is not an in-depth review. This is not a 3-4 day review. No, this is a review where I go over the type of questions you should expect to see, the type of content you better know for that exam, and just different strategies, test-taking strategies to answer the question, even if you don't know what the answer is. So you can find my booking information as well as audio lessons on my website, nexusnursinginstitute.com. And let's get started. Antipsychotic medications. Antipsychotic medications, they block which receptor? Dopamine, serotonin, acetylcholine, or epinephrine? What do you guys think? What do you think? Choose an answer. Okay, so the correct answer, very good, is dopamine. So most of you guys chose dopamine. So let's talk about this. Remember, dopamine is important for, the communication of impulses. It's important for motor and just intellectual activity, right? When we're looking at serotonin, which was the wrong answer choice. Remember, serotonin, that's a neurotransmitter. Serotonin is good. We call serotonin the feel-good neurotransmitter because it helps prevent depression. When we're talking about acetylcholine, acetylcholine is good for communication between the muscles and the nerves. And last, epinephrine. Epinephrine is a catecholamine. Remember, epinephrine is good for what? The fight or flight response. Anyone who's been following me for a while, you know my story about what happened in Puerto Rico and all that epinephrine and all that fight or flight response that I had in my body because I either was going to fight, which I was ready to do because I'm Professor D, or flight. So anyway, when it comes to antipsychotic medications, they block dopamine. Very important for you guys to know. What is the safe dosage range for lithium? 0.4 to 1, 0.6 to 1.2, 1 to 2, or 2 to 3. This is very important to know because NCLEX absolutely expects you to know this range for lithium. It has a very narrow therapeutic range, and you have to know it. Very good. 0.6 to 1.2. Most of you guys chose the correct answer. Make sure you commit that to memory. When are antipsychotics contraindicated? Select all that apply. As always, guys, how do you treat select all that applies? You have to treat them as true or false. So let's go. Elderly patients with dementia, glaucoma, active alcoholism, pregnancy, lactation, thyrotoxicosis. Select all that apply. This is interesting. Okay, so let's talk about the correct answers. What conditions, what would be contraindicated in a patient that's taking antipsychotics? So let's start with elderly patients with dementia. And this is true. I want you to think about it. First of all, patient just being elderly, that puts them at risk for a cardiac crisis or a cardiac episode, and even death, right? And if they have dementia, when a patient has dementia at one point or many points or another, they're going to be out of touch with reality. Remember, dementia is progressive, it's ongoing, it's a declining of the patient's cognitive status. So why would you be giving them an antipsychotic? That is contraindicated. If the patient's elderly, they've got dementia, you are not going to give them an antipsychotic. Next, glaucoma. That's also contraindicated in the patient taking antipsychotics. Why? Well, guess what? Antipsychotics have anticholinergic properties. You guys remember the poem I taught you about anticholinergics? Can't see, can't spit, can't pee, can't, right? Remember that? Can't see, blurred vision. Can't spit, dry mouth. Can't pee, urinary retention. Can't, constipation. So a patient with glaucoma, and we know that antipsychotics give you anticholinergic properties. They have anticholinergic properties, and we know that it can cause vision problems. Why would you give it to somebody with glaucoma? Absolutely not. So yes, it's contraindicated. Next, active alcoholism. Come on now. First of all, antipsychotics have their action, they depress the CNS. That's what they do. What does alcohol do? Also depress the CNS. But let's say you forgot that alcohol was a CNS depressant and you forgot that antipsychotics decrease the CNS as well. Let's say you forgot that. Do you ever take alcohol with medications ever? Absolutely not. So active alcoholism, absolutely. That's going to be contraindicating somebody that's taking an antipsychotic. Let's move on to pregnancy. Let me tell you something. If you don't know the answer and you have to guess, pregnancy and breastfeeding is always going to be a contraindication. If you have to guess, go yes to contraindication. And absolutely, antipsychotics are going to be contraindicated in pregnancy and lactation because it crosses through the breast milk. And thyrotoxicosis, that also is true. Let me explain why. If the patient has thyroid disease, they have thyrotoxicosis, if they take an antipsychotic, that will decrease the threshold for seizures. So the patient is going to be at a much higher risk for having seizures, okay? So all of these conditions are contraindicated for the patient who is on antipsychotic medications. True or false? Patients receiving antipsychotics should have a baseline and periodic ECG during therapy. True or false? What do you guys think? I'm not helping you. True or false? All right, guys, I see you on the live. Those that couldn't join. True, very good. So let's talk about this. With the antipsychotics, they can increase the QT interval. So you want to get a baseline and make sure that this patient doesn't have any cardiac history that might cause a problem down the road. And let's say they don't, and they're started on this antipsychotic medication. Periodically, you're going to want to be doing that ECG, looking at that ECG just to make sure that the patient is not developing a cardiac event, that nothing's happened, nothing's going on with them, because this medication, again, can increase the QT interval. You guys are doing great. What lab values must be monitored for the patient on antipsychotics? Select all that apply. WBC, RBC. Guys, there's a third WBC here, but I meant to put platelets. I've been really sick, and when I made this, who knows what I was thinking. So this is platelets, BUN, creatinine, and LFT. LFT stands for the liver function test. So select all that apply. Choose all of the lab values that you think should be monitored when a patient is on antipsychotic medications. Okay, so let's talk about this. Every single one that I have listed here, they need to be monitored, and I'm going to explain to you why. So let's start with the WBCs, the RBCs, and the platelets. Antipsychotics can cause blood dyscrasias, and it's can severely decrease those blood cells. Where are the blood cells made? In the bone marrow. So you can it can severely decrease the WBC, so that patient can be at risk for what? Infection. We're going to be watching out for infection. It can severely decrease the RBC, so we're going to be concerned about things like, anemia, and it can severely decrease the platelets, so we're going to be worried about bleeding. So we're definitely going to be looking at the WBCs, RBCs, and platelets. Now let's move on to the BUN and creatinine. Those tell us what organ does the BUN and creatinine tell us about? Guys, thank you so much. I see you on the live. I see you guys answering. You're doing great. The BUN and creatinine tells us about the kidney function. All right, Professor D, why would the kidney function be important for me to know as a nurse if a patient's getting an antipsychotic? Let me tell you why. If that kidney is not working the way it's supposed to, guess what? That medication's not being metabolized the way it's supposed to. It's not being broken down the way it's supposed to. That means it's going to be adding up and adding up and building up and building up in the body. And before you know it, that patient might have a toxic level. So you better be looking, I'm talking about the kidneys. You better be looking at the kidneys. And let me back up a little bit, because when I told you not metabolism, I'll talk about the liver, not the kidneys. Let me back up a little bit. I'm going back. The kidneys is good for excretion, that the kidneys get rid of the medication. So the reason you're looking at the BUN and creatinine is because if the kidneys aren't working the way they're supposed to, they're not going to get rid of the medication the way it's supposed to, and it's going to build up and build up and build up in the body, and the patient's going to have a toxic level. Now let's talk about the LFTs. The LFTs, which is the liver function test, the ALT, the AST, that tell you about the liver. The liver is responsible for metabolizing the medication, for breaking down the medication, right? If that medication is not being broken down the way it's supposed to, just like if the kidney's not working, it's going to build up in the body. If the liver's not working, it's going to build up in the body, and the patient can have a toxic level. So you have to be concerned about the liver because of metabolism, and you have to be concerned about the kidney because of excretion. So we're going to check all of these while the patient's on that medication. True or false? Sugarless candy and ice chips should be provided to the patient on antipsychotic medications. What do you guys think? True or false? And guys, keep answering for me in the live. Keep going. Those that couldn't get in on the Kahoot, I want to see your answers. If you see my eyes switching, guys, I'm going between you guys and the screen for the TikTok live. Very good. Most of you chose true, and that's the correct answer. So let's talk about this. Remember how I told you antipsychotics have anticholinergic properties? Remember I reminded you about the poem I taught you for the anticholinergics? Can't see, can't spit, can't pee, can't, right? Can't see, blurred vision, can't spit, dry mouth. Dry mouth. So to help alleviate that dry mouth, you're going to offer the patient sugarless candy. You're not going to offer them candy or gum, because you mess around and turn them into a diabetic and they'll say it was your fault. No, sugarless candy or gum, because that'll help decrease that discomfort of having the dry mouth, or you can offer ice chips. In the manic phase of bipolar disorder, what should be the nurse's priorities? Select all that apply. Hyperexcitability, depression, nutrition, rest, fluid and electrolytes, fear. What do you guys think? Select all that apply. I am not giving you the answer. That's my daughter with me, trying to get the answers. Okay, so let's go over the correct answers. The question again, patients in the manic phase of bipolar disorder, what should be the nurse's priority? Let me tell you something. I don't care what the disease process is. Whenever you're asked what your priority is going to be for the patient as a nurse, you need to be thinking about keeping that patient alive and keeping them safe. You need to be thinking Maslow's hierarchy of needs. You need to be thinking physiological integrity, as in nutrition, fluid electrolytes, glucose, hemodynamic status, ABCs, vital signs, anything that is physically keeping your patient alive, right? So let's take a look. The first choice, which was wrong, hyperexcitability. Hyperexcitability is just one spectrum of bipolar disorder. The patient can be in depression, or they can be in the manic or hyperexcitable state. That's not going to be your priority. Next, depression, which is also wrong. That is just one of, that's a part of the disease process, right? That's one of the spectrums of bipolar disorder. Nutrition, yes, that's a priority, because without nutrition, our patient will be what? Dead. Rest, yes, that's a priority, because if you go back to the question, what phase of bipolar disorder is our patient in? The manic phase. That means they're going. They are not stopping to eat. They're not stopping to sleep. They're not stopping to rest. They are going until they find physiologically, physically, they collapse. Their body shuts down. So yes, rest is also going to be a priority. Fluid electrolytes. You guys know how important fluid electrolytes are. Doesn't that fall under physiological integrity in Maslow's hierarchy of needs? Of course it does. So that's going to be our priority. Fear, Let me tell you something. When it comes to emotions and teaching, yeah, that's important to us, but it's never going to take precedence or priority over physiological integrity. Okay? You guys still with me on the live? All right. An adverse effect of antipsychotics are trap symptoms. True or false? Remember the trap symptoms of Parkinson's disease? True or false? What do you guys think? True. Very good. So another thing about you that's very important for you guys to know about antipsychotics is that they can cause pseudo-Parkinsonism. Pseudo meaning fake, false, Parkinsonism. So they give the symptoms of Parkinsonism, but the patient doesn't have Parkinson's disease. So what are those trap symptoms? What are those same symptoms we see in the patient with Parkinson's disease? Tremors. Even at rest, you'll see those tremors, right? Rigidity. Remember how when you walk, your arms, move in a fluid motion to help you keep your balance, but the patient with Parkinson's disease or the pseudo-Parkinsonism, they have that cogwheel effect where, instead of their arms swinging, normally their arms are swinging like this, like a cogwheel. I don't know if you guys can see, like this. It's like so weird, so robotic, right? A, ataxia, they're walking very weirdly, or akathisia, where we're concerned about their safety, and P, postural instability. Very true. What are the significant adverse effects of antipsychotics? Select all that apply. Again, guys, don't forget, treat, select all that apply as true or false. Hypotension, anticholinergic effects, sedation, extrapyramidal effects, nausea, pruritus. What do you guys think? All right, let's go over this. So the significant adverse effects, before I even get into this, let's clear something out. You have side effects and you have significant adverse effects. Side effects are things that you kind of warn the patient, hey, just so you know, these are the things that may happen while you're on this medication. And those significant adverse effects, or adverse effects alone, are the symptoms that you tell the patient, hey, if you experience this, you have to let us know right away, because the healthcare provider is going to do something. They're either going to take you off this med, they might decrease the dosage, they might add another med. We're going to have to do something. So if you see X, Y, and Z happen, let us know right away. So there is a difference between side effect and adverse effects. So let's get that out the way. So this question is, what are the significant adverse effects of antipsychotics? Let's start with hypotension. Remember, I already told you that antipsychotics have an effect where they decrease the CNS. And one of the things that antipsychotics do is you'll see a decrease in the blood pressure, especially when that patient changes positions. What's that called? Orthostatic hypotension. Patients on antipsychotics, we are going to be very concerned about safety, because if they were lying down and then they stand up, that blood pressure might drop and your patient be on the ground, right? So we're going to be concerned about safety, hypotension. True. Next, anticholinergic effects. Everybody should have gotten this correct, not only 29, because this is the third time that I'm telling you that antipsychotics have anticholinergic effects. Can't see, can't spit, can't pee, can't. Come on. Next, sedation. Yes, sedation, because we know antipsychotics decrease the CNS, right? So the patient have, they may have sedation. So you're going to be teaching that patient not to drive or operate heavy machinery until they know how their body is used to that medication, because it may have sedative effects. Extrapyramidal effects. Yes. Such as what? Those trap symptoms that I was just telling you about. Nausea. No, nausea may be a side effect, but it's definitely not an adverse effect. It's not significant adverse effect where, you know, we would have to notify the healthcare provider about that. Now, if the patient had excessive vomiting, that would be something else, because now we're worried about fluid and electrolytes, but I'm getting into something else. Next, pruritus. Incorrect. Pruritus also is not an adverse effect of antipsychotics. So the correct answer is hypotension, anticholinergic, sedation, and extrapyramidal effects. We are down to our last question. What is the most common psychosis in which delusions and hallucinations are hallmarks? Bipolar disorder, schizophrenia, dementia, or delirium? What do you guys think? This is the last question, guys, on the live. Don't be lazy. Put your answers in for me. Very good. Schizophrenia. That absolutely is the most common psychosis, where patient has delusions, which are false beliefs, and hallucinations. Oh, hallucinations, which are, you know, where the patient may have a visual hallucination where they're seeing something that's not there, or auditory hallucination where they're hearing something that's not there. So that's schizophrenia. Oh, third place, Helen. I wasn't done teaching, but I guess I am. Second place, Shar. First place. Who won first place? Kiesha, congratulations. Great job. Runners up. Fourth, Elizabeth, and 5, D. Nicole. Okay, guys, before you guys get going, I just want to say just one more thing, because this is very important for you to know, because you're going to need to know it for testing purposes. The last two on the bottom, dementia and delirium. It is very important that you guys know the difference between the two. Dementia and delirium. So let's start with dementia. Dementia is progressive. As time goes on, it only gets worse. So what's happening is basically a person's brain is really deteriorating, right? It's turning into mush. And so the patient becomes more out of touch with reality, and it's not reversible. But delirium is reversible. With delirium, there's an underlying cause. And once you correct that cause, the patient's not confused anymore. So when a patient has delirium, especially if it's a geriatric, it's an older patient, the first thing you need to be thinking about is infection. Most likely this patient has infection. And as soon as that infection is cleared up, they get the antibiotic or antiviral, whatever it is that's going on with them. When it's cleared up, that patient will no longer be confused. And so they will not be delirious anymore. So it's very important that you guys do know the difference between delirium and dementia. So for you guys that are watching on YouTube, thank you so much for sticking with me throughout this entire video. I know I've been going back and forth with my viewers on TikTok. I appreciate you watching the entire video. Again, please do not forget to like this video, subscribe to my channel if you haven't done so already. And don't forget, you can now book NCLEX NGN review sessions with me on my website, nexusnursinginstitute.com. And you can get audio lessons on my website also at nexusnursinginstitute.com. Guys, thank you so much for watching, and you guys will catch me on the next video.